If you're struggling with an achy or sharp knee pain that feels like it's behind or around the kneecap, these patellofemoral pain syndrome exercises are just what you need. But first, comment below and tell us your experience with knee pain. Hi, I'm Dr. Nicholas Mercer, physical therapist and creator of Pain to Peak, your first line of defense against musculoskeletal pain. Patellofemoral pain syndrome is one of the most common conditions I personally treat. It's characterized primarily by pain behind and around the kneecap when the knee is bent under loads, such as climbing steps or running. The potential cause of this debilitating syndrome varies wildly between individuals. Luckily, the research is conclusive. Improving the strength of the hip and the knee is consistently associated with less knee pain. And if you're looking to fast track your recovery, the exercises in this video are essential. But first, we have to understand how to do these exercises properly. Otherwise, you run the risk of worsening your condition. Our priority is going to be minimizing inflammation and pain in the knee while increasing the ability of the knee to handle increasing tensile loads. We will be using a concept called overcoming isometrics to teach the quadriceps how to handle increasing amounts of tension in gradually greater ranges of pain-free motion. This way, we can minimize the local inflammatory response of traditional concentric-eccentric strength training while safely increasing the range of motion of the knee under loads. To begin, lean your back against the door frame and walk your feet forward, holding onto the opposite side of the door frame. Use a pillow or a foam pad if this is uncomfortable on your back. Bend your knees slightly and begin to push your lower back and pelvis into the door frame. You should feel your quads and glutes tighten. If this is not painful, increase the effort you're pushing into the doorway gradually to 100%. If you experience knee pain at this range before hitting 100% effort, straighten your knees slightly more and repeat this process until you find the range of motion in the knee that is both not painful and allows you to drive 100% of your force through the door frame. Once you find this range, hold that 100% force for 5 seconds, then relax for 10 seconds. Repeat this for 3 to 5 repetitions. As long as your pain is not increasing and you're not sore, you can do this as much as you want throughout the day, since isometrics are much less likely to cause a local inflammatory response. Over time, usually 3 to 5 days, you'll notice that the pain-free range you're able to achieve while exerting 100% force is maybe 10 to 15 degrees lower than when you started. This should continue over weeks and months. Once you pass a 90-degree angle at the knee with 100% effort, you can start experimenting with squats and lunges in a pain-free range. To be safe, I would stick to a range that is at least 15 degrees higher than your maximum overcoming isometric wall sit. So if you can only get to an 85-degree angle with the overcoming isometric wall sit, keep your squats and lunges at about a 100-degree angle of depth. Of course, it's your body, so feel free to experiment with going lower than that as long as it stays pain-free. In addition to this, as a secondary measure, we will use traditional strengthening exercises to improve the strength, mobility, and control of the hip muscles responsible for rotation and lateral movement of the hip, since the hip is not the painful joint in patellofemoral pain syndrome. This ensures that as the knee becomes pain-free and we start introducing knee movements and return to activities, we aren't driving unnecessary lateral or rotational forces through the knee joint. We will do this utilizing a 3-way clamshell. Start by lying on your side with your knees bent at about a 90-degree angle and your hips flexed at about 45 degrees. Place your hand on your top hip and ensure that hip does not roll back with any of the movements. Keeping your feet together, separate your knees as much as possible, holding for 3 seconds at the peak of the movement. Do this for about 10 repetitions. Then, keeping the knees together, separate the feet as much as possible. Again, holding for 3 seconds at the peak of the movement. Do this for about 10 repetitions. Finally, lift the whole leg up and away from the leg on the ground. Hold this for 3 seconds and repeat for, you guessed it, about 10 repetitions. Try to do this at least 2 times a day. Remember, your priority is the wall sit to restore the proper health and stability of the knee while incorporating hip, lateral, and rotational movements in preparation for a return to your favorite activities. Recovering from patellofemoral pain syndrome takes time and effort. But if you follow the guidelines in this video, I'm confident that you will see results sooner than you expect. Make sure you comment below and tell us your personal experience with knee pain, and check out paintopeak.com, your first line of defense against musculoskeletal pain. Thanks for watching.